helping make your life easier. Moms Every Day.
Hey, welcome to Moms Every Day. Today we have Shawn Bastin with us from Cabell Huntington Hospital. We're going to be talking about the Marshall Sports Medicine Institute. Brand new. Might sound, maybe a little scary for some. I don't know exactly how to put that, but everyone's welcome. So we got to give it a chance and listen to what exactly it is. Give us an idea.
Sure. The Marshall Sports Medicine Institute is a collaboration between Marshall University, Marshall Health, and Cabell Huntington Hospital. And what we've done is we've tried to bring the best of all of those entities under one roof to provide a very comprehensive high level of care for all level of athletes, not just the Marshall Collegiate or the high level Division I athlete, but the weekend warrior or the active lifestyle person. And it's tried to be able to provide that same level of care regardless of the skill level of the athlete.
Right, so you don't have to be a warrior like you said. You can just be getting started and come right to the institute. The suspense has been building for this all summer.
Sure.
If you've been watching any of the ads, you definitely know. You may have been wondering, what does this mean? What's going to happen summer 2015? Then now we finally know. So just talk about some of those services that are going to be available.
Sure. One of the key factors is we keep using the word comprehensive, but it's very comprehensive in the scope of what we offer. So we provide everything from athletic trainers that are deployed at local high schools that are kind of with these high school athletes every day. We have a group of physicians, and those physicians are orthopedists. There are family practice physicians that specialize in sports medicine. We have neurologists that manage concussion management, physical therapists. We have chiropractic specialists, we have massage specialists, we have sports nutrition specialists. So we really wanted to try to cover all of the bases of an athlete and the types of problems and difficulties they may have under one roof.
Sounds like a lot of critical thinking and list making in order to figure out exactly where you were going to go with this. Okay, now talk about just the community benefit and what it means to have everything underneath one roof.
Sure. The real advantage for that is communication. So when an athlete or an individual gets injured, typically what's happened is they've kind of been almost shopped out to different facilities in different places. So you may see a physician at one place and have your imaging, your x-ray done at another place, and maybe your physical therapy across town. And the challenge with that is those individuals very rarely communicate with each other, or if they do, it's very limited. So with all of these services being under one roof, that care is very consistent. So the physicians and the physical therapists are communicating, and they're actually talking and discussing and working with the patients as they go through the entire process of an injury, from the injury to potentially surgery to rehab, back to a high level of performance training to get them back to where they need to be. And it's all under one roof, and everybody's on the same plane and has kind of the same treatment plan for that individual.
Right, and like you said, when it comes to being a competitive athlete, you don't just have to be a competitive athlete to use these services. Things happen every day, and these kind of injuries happen.
Absolutely, that's correct. We certainly pride ourselves in treating the highest level of athletes in our area, and these Division I athletes is certainly something we're very proud of and we take very seriously. But really what we want to promote is we're selling that same exact service to you or I, or to the weekend athlete that maybe injures themselves, that they need to rest assured that they're going to get that same continuity of care and level of care that we do give to those Division I high-level athletes.
And did you say there were massage therapists?
We do have a massage therapist on staff there.
And is that just for aches and pains, or do you need a referral to go see them?
No, it's kind of for general aches and pains, but this person, like all of the individuals, have some specialized training in sports medicine as it relates to their field. So each of the individuals have either a certification or a specialization that's specific to that particular sports medicine population. So the massage therapist has that as well, and we kind of work everyone under that umbrella of being specialists in the field of sports medicine.
All right, and then the technology, I'm sure you have a lot of different stuff going on.
Sure, we do have a lot of technology. One of the advantages we have is collaborating with all of these entities specialties gives us the ability to bring in some pretty unique technology. For example, we have a treadmill that's zero gravity, or an anti-gravity treadmill.
That's interesting
So we
concept.
can put a person in this particular treadmill, and it will unload their body weight up to 80%. So,
what does that mean?
So imagine if you had a knee injury and you had surgery, and the doctor says you can't put weight on this leg.
Oh.
So we can put you in this treadmill, and we can rehab this person probably 4 to 6 weeks sooner than what we could if they had to do it without this technology.
The things that they come up with,
so
right?
being able to do these things will really expedite care, and will get people back to where they need to be quicker.
Awesome. All right. Well, if you need any more info, you just head to our website, WSAZ.com. You click on the Moms Everyday tab. You can rewatch the interview and find out all you need to know about this new Marshall Sports Institute. Be back in a minute.